thing was, okay, if I do a startup, where's my cash flow gonna go? There's big tiny dentists around here. I'm pretty much swimming with the sharks.
All right, what is up, guys? Welcome back to the channel, San Diego Dentistry. I'm here with Dr. Daryl Torculas, who's a practice owner in Linda Vista, San Diego. And the purpose of this interview is going to be to talk to him about how he got into buying his own practice, the struggles he's having, and the successes he's having. And hopefully you guys get some insight about if you're interested in buying a practice in the future, or if you're just interested in how dentistry works.
Yeah.
So let's get started.
All right. Thanks for having me, first of all.
Appreciate you for coming on in. I think the first question we should start with is, you're a relatively young dentist, and I think a lot of dentists out there, they eventually want to possibly own their own practice.
Right.
And if you can kind of go over the story about how you came to deciding on owning a practice and starting at such a young age.
Right. Yeah, so just for background, I went to Indiana University, graduated in 2016. Went to residency at Ohio State for 1 year, and then came back home. So San Diego is home. After that, I worked as an associate for 2 years. Still currently am working at the same office or same owners. And pretty much the way I viewed dentistry was, I knew I could do more than just work for someone. When you work for someone as an associate, you don't have the experience or the skills to learn how to manage an office. So I took the opportunity, I'll work for them, and learn as much as I can. At the end of the day, when I was watching what's going on behind the scenes, they were making, it's not for the profit or anything that I'm thinking about. It's like the value that I'm putting out, and in return is where the discrepancy was. I felt like I wasn't being returned the value for what I was doing, and I was making them money. Obviously, it's a business move for them, and they pay me a certain X rate every day, and then they can stack the schedule as how they want it. Now, not all business models are like that, but that's pretty much how they run it. I don't get production, so it's pretty much, here's your daily rate. Then they can make me produce up to, let's say, for example, there's days where I've seen where $10,000 worth of production on my schedule, and that's pretty nice on their part, on the business end. So I felt like, my value, I feel like I can do better with that. I also didn't have the freedom to do what I wanted to do. So I was at their mercy of treatment planning. Although our philosophies matched and I was okay with doing the treatment because it was within my ethical boundaries, at the end of the day, I wasn't the one making the call. For some patients, yes, if I could make a call at the appointment, but from meeting the patient to, talking to them, having that rapport or having that connection, that human connection, I didn't have that. And that's what I was missing because, when I see them, that's probably their second or third visit. After new patient exam, x-rays, exams, and they would come in, do a cleaning. Then after that, they would see me. So they've seen already probably 2 or 3 people before they get to me and start doing their dental treatment. And sometimes they're like, oh, who is this guy? To me, it felt like just another person in my chair because I didn't establish that connection with them. And I felt like that's where the practice ownership came to mind, where for my value, what I know what I can do, and then more of establishing that connection because I felt like a cog or a wheel in the cog or system to the system because I was part of their business system. Now, It's not a bad thing, but that's just how it is, So, yeah.
So your practice is in Linda Vista?
Yes.
Currently?
So it's middle of downtown San Diego.
Middle of downtown?
Or not downtown, middle of San Diego.
Middle of San Diego?
Yeah.
So how did you go about finding this practice? There's a lot of people out there that may want to search for the ideal location for them to get started. But, where do you start? I know that in San Diego, Dentistry Magazine, they have practices for sale. What avenues does a young dentist or any dentist who's looking to buy their own practice have in discovering a place that they can purchase?
Right. So for me, there was a choice of either startup or acquisition. Now the big thing was, okay, if I do a startup, where's my cash flow gonna go? There's big time dentists around here. I'm pretty much swimming with the sharks if I'm doing a startup. Now, is it possible in a big city? Sure. You just got to go with the risk. I went with a more conservative risk in terms of I found a doctor that was ready to retire. You know, he's been in the community for about 20 plus years, and he was ready to turn over. His patients have been with him. They've been pretty loyal. So I was like, hey, doctor's retiring. Check. Okay. You also got to look at, okay, he's a male doctor versus a female doctor. I'm also a male dentist. So it's more of like, they're used to a male doctor. Okay. Male doctor. Check. Now, he was also Asian. I'm Asian. So that kind of already is like...
So you think gender and race, you wanted to try to create an equal type of transition.
Correct.
So the only thing that would be different would be youth.
Exactly. So he was, you know, ready to retire. I'm on the younger end. So that's where, you know, that's where the difference is. But in terms of how those patients perceive me, like, okay, you know, as Asian guy, I'm Asian, you know, Asian American, great. Like, they're not like, oh, hey, like, who is this guy, you know? If it was a female, you know, it would have been like, oh, like, I'm used to the guy, you know, like, even though it may not seem like a big deal, it is to some patients, and they've been used to it. They've been to him for 20 plus years. You kind of want to keep that consistency.
I totally get it.
Yeah.
You're trying to create as seamless a transition as possible. Now, you know, you can try to make it as seamless as possible, but I'm sure there's differences in style and technique and and also age. So,
of course, yeah.
Have you had problems with patients maybe questioning? They're used to an older generational doctor, and you're a younger doctor.
Right.
Have patients left because of this? Is it a problem that you're seeing when you work at your office? Can you kind of elaborate upon what struggles do you have as you come into that practice?
So it's more of a mixed response. So how it turned out was he pretty much gave me the keys, and the next day it was just me. He sends out a letter. No one knew that he was selling. And that is in part because, as a buyer, you don't want to lose patients right at the bat because he's leaving. So then you already lose patients even before you even buy the practice. So they had to keep that, you know, a little like hush. So no one knew what was going on. So you sign like a non-disclosure agreement. You know, you can't tell anyone.
Tell anyone what?
Tell anyone that, hey, I'm buying this practice. You know,
okay.
Or because then, you know, people talk. You know, the community is small. People will figure out, okay, he's leaving. Shoot, do I like this guy? Kind of thing. So word gets around. In terms of patients coming back and returning, it's sort of a mix. You know, there's a few patients that like the way he practiced. Let's just say there's some things where the office need updating. He's been there for 20 plus years. It's more of me trying to flip it and get it back to standard, or the standard I feel, so that I feel comfortable giving the proper care and be able to sleep well at night for these patients.
So by updating, what do you mean? Do you
So
mean
you're
the
talking
chairs
about-
are out of date?
Not
or
the
is it
chairs, but more
resin?
of like the procedures, sterilization procedures.
Okay,
You
so
know,
you're just making sure everything
instruments.
is tight and the way you want it, and
Right.
everything's
And up to standard. You
Up to
know,
standard.
he's been there for a while now. May have relaxed. When he knows he's ready to retire.
But not saying that he's not up to standard. You're
Well, yeah,
saying
he's not up to
that
standard, but like
you wanted
the
to have your
facilities,
system. Yeah.
right? The facilities were, you know, they needed some help. I mean, his standard was good, but I wanted to be like, okay, let's make sure this is legit, and I'm not messing around. You know, I'm making sure like, okay, this is the standard of care how I was taught and what I see, in terms of what's going on in the industry. These patients are more or less used to his style of treatment planning and patients because I've been with him for 20 plus years. So, you know, when I'm bringing the camera, they're like, oh, what are you doing? You know, I'm taking all these photos, taking measurements. They're like, hey, he never used to do this. Or what is that? You know, like I'm talking about the piezo scalers. Like, oh, he only used that from time to time, you know, and I'm over here using it almost for every patient for cleanings.
Oh, I see.
You know?
And I totally get that.
So they're like, hey, he never used to do that.
Yeah.
Okay.
It's
Or
a different
like,
style. It's
Yeah.
a generational style. I mean,
It's not. Yeah.
for those of you that may not know, my mother's been practicing for 33 years, and as I joined her practice, there were things like that, where we weren't using the piezo as often as how I would want to use it.
Right.
And it's just a different change in style
Right.
and efficiency.
Yeah.
And also, what we're taught that it's now become the standard of care. So implementing that system for cleanings or whatever it may be can be a much better improvement in care. So I totally get that.
And then, like, for example, full mouth x-rays. Like, man, I've never had so many x-rays, and that's like 18
images,
18 pictures
and that
taken.
can be shocking or jarring to
And
patients
they're like,
who aren't
wait.
used to it.
And then they question. They're like, wait, he's never done this. So there's a discrepancy of like, hey, what did he used to do?
Yeah.
The question, like, okay, and then here's this new guy.
Yeah.
Okay, what's going on? And I do what I was trained to do to the best that I can and provide the quality care. So a lot of the patients, it's new to them because all they know is what he's done
That's
for
true.
X amount of years. So I mean, in my part, I've seen they're more like, oh wow, I didn't realize this, and it's a lot. I've seen them. It's been a lot for them to handle because from when they step in, to like, oh hey, like to processing payments or how everything feels, phone calls, personal phone calls, everything feels a lot different. So now they're like, whoa.
Yeah. It's
a
hard.
lot. It's
and you want to
improved.
make it gradual, but you
Right.
want to you got to change things to make it your way. I do have a point to make about x-rays, and I don't think it's just generational. There are dentists that are trained different ways from different schools of thought. There's some dentists out there that I talk to regularly who are excellent dentists who take a pano every year, and there's some that take an FMX every year. There's some that take a CBCT sometimes. So it is. I think it is a little bit dependent upon
the style of
practice, what their train of thought. I don't think necessarily anyone is particularly wrong or right, but it has to conform, since it is your practice now, to your style. So I can imagine that would be a really hard transition to make. So
or the fact that I put computers and they're like, oh, like I used to go to room 1 for my x-rays, move over to room 2 for my cleaning, and then almost every patient walks straight to room 1.
Yeah.
And then we're like,
It's
wait, we go to room 2 because we have the x-ray now and they're in the computer. And they're like,
so now that the systems are in place that's a little bit different than what they're used to, have you noticed that maybe some patients have left because it's a different change, a different style? And does that concern you every day when you're there?
No, it doesn't concern me because at the end of the day, the way I diagnose and the way I treat, I call it the way it is. I have my photos, x-rays to back it up. So I show them and we have a discussion of like, hey, patient so-and-so, I'm the new doctor. I'm Dr. Torculas. And I always ask him like, so what do you know about your previous oral health? What did Dr. so-and-so tell you about your teeth? And they give me the background. So I kind of gauge like, okay, they know what's going on, so I don't have to do a whole lot of explaining. Or like, they tell me like, I'm just here for, he just used to do this, and this, and then whatever I need, he would do, and then I'm like, okay. And then, once we start further into the conversation of like, this is what's going on with your teeth, this is what can happen, the risk, and what's some proposed treatment, then they're like, okay, hold up, let me take a step back, because before, the previous doctor never used to do it, and then now you have this other doctor who's like, hey, this is something, so like, this is something new to them.
So that is hard. How long were you with him before he left? Was it an immediate transition?
Yes, so it's pretty much, I met the guy maybe once or twice,
Was it just that he wanted to retire immediately? He didn't want to take you on as an associate for a little bit? And
he just wanted to turn it over. He was ready to go. He's like, you know what?
Which is how some people do it. But does that, I know some practices that do it that way, people that are ready to retire and they just want to sell it immediately. It poses a lot of hardship, right? It's hard because you weren't introduced to the patient pool.
Yes, I agree.
Do you think for, new dentists out there, what's the best path? Is it good to go straight in, or should they be a slow transition? And I know that when they do that, maybe they put them on payroll for a little bit and they start to give them some percentage. Do you know about that style, or is that something that happens?
So my one thing or recommendation, or from what I've seen, when I was going through this process, is if you're going to keep that existing doctor, have in the contract the date that they're going to leave.
I see.
For termination. Because if they prolong they're still gonna have some control over how you run the practice. And until they leave, you won't feel like you have full control.
I get that.
Because then, you do one change, you're like, oh yeah, but these patients don't like this kind of thing. You're always gonna have that other doctor kind of been like, because it's still it's his baby, like it's this thing that he built, So yes, you just gotta make sure that that's an agreement, that you agree. Now, in terms of length, I've seen 1-2 years. I probably personally wouldn't go more than 2 years, and probably 2 years, even 1 year, just to kind of get your name, get you to introduce to the patient. But hopefully, in that scenario, what I would see happening is like, okay, even before you started, I feel like even before you get to that point, you are probably working as an associate for him already. And then the opportunity presented itself of like, hey, Dr. Sammy, would you like to buy my practice?
Yeah.
Okay, so then in, let's say 2020, I'm going to retire in June. I sell it to you, I put the date down, great. You've already been working for me for 1-2 years, right? And then in 6 more months, I'm comfortable leaving. So that's the only scenario I see where you keep the doctor in, and then where you would be the owner. And then let me preface this too. This goes back to when you're job hunting. So for example, when I interviewed as an associate, I always asked the question of, is there an opportunity for me to buy into the practice? Which tells me, if they say yes, that means I have a chance to acquire that practice if it's doing really well. Now, in my experience, they said yes. I was given the runaround, but it wasn't really discussed after. Yeah. But I did ask that question.
Gotcha.
Hence, this is why I ended up buying my own versus trying to buy into what's already where I'm at, because even though I asked, it was never brought up again. So that's where,
Is there a number of the amount of turnover that happens when you acquire a new practice? I've heard somewhere you should expect like 25% of the patient population are going to leave just because it's a new doctor. Right. Is that a number that you've heard before?
I've heard of, the number I heard was 30%.
30%.
Now I've seen more or less. I've seen the patients that I've seen and scheduled, and they've come back. It's hit or miss, as in like they've come back for the recall. So
Gotcha.
now I am actually going on my seventh month of practice ownership.
Congratulations.
Thank you. And now some of them are coming around. Okay, there's one person that comes in. Let me go see what this new doctor's about. So then one hears, okay, I'm okay now. So
good. Stop it right there for a second. Sorry, guys, we have a timer because our cameras end at 20 minutes. So I'm gonna check the cameras. We'll be right back.
And cut. Someone who's considering trying to go to dentistry for money, you might want to look somewhere else, because you're gonna have school loans unless you're well off and you can afford, if you can get it paid off.